to Dr. Rush. Just hold on, give me a minute. All right. Everyone can hear my voice and can see my slide. I hope so.
Can hear the Prof.
Okay. So I want to proceed my talk now. So today I will be sharing a topic on mental health and women, and I would like to thanks to MMA and to the Lions Seremban for giving this opportunity to talk on these important topics. And we already here. I'm the second man for today to talk on this topic after Dr. Selva, after listening to two ladies doctor. So I hope I can complement some informations with regard to this topic. My background, I'm a psychiatrist working in University Malaya Medical Center, affiliated to University of Malaya. And just to share some of my background, actually, I'm do research as well in my interest in addictions as well as in the field of correctional mental health, where my research involved in the prison. So I definitely cannot avoid talking about situation in the prisons. And of course, for today, I will be sharing some information about prison mental health among women in the prison. So I think it's not too late to wish happy Women's Day lah for all those women, mother, girls, and everyone who so-called belong to this group. And I'm delighted. Probably my view, I should disclaim myself. I'm probably can be considered from external because if women talking about women, it will be it is like very self-own topic. But I'm a man talking about women's, like try to see from outside perspective as well. So mental health. Nowadays, I think mental health become important topic in daily discussion among people. I mean, nevertheless, we can see mental health or like depression will be the highest burden of disease in year 2030. So it can cause uh, load of cost due to this illness estimated by 2030. I mean, not long to go, to reach that level. In fact, in 2020, in the year of 2020, mental illness will be was number two of burden of disease. So looking at these topics, more focus. I mean, where today we more focus on the right to health for women, for women health. So this is a very important consideration. But overall, from normal point of view, we take, and I'm dealing with patients. We always mention men and women, supposedly in the complementary situations. That means try to want to complete to another. I mean, in terms of social role or individual role and so on. However, people always say men from Mars and women from Venus, look like two different, not right to say, two different species. That means perhaps some basic biological is the same, but there's a differences where I'm going to elaborate a little bit further because it's relevant to the discussion. And also, we can talk about another aspect, spiritually or not really spiritually, but emotionally different between men and women, which is more clear in that way. So there's a evidence showing that relationship between sex and gender and mental health. So meaning that different sex will have different mental health issue need to be addressed. Women are significantly higher incidence and prevalent of certain type of mental health than men. This is quite well known. For example, we are talking about uh, those who condition not won't happen in men, okay, only happen in women. For example, perinatal depressions, or we call it those days, postnatal depressions, puerperal psychosis, mostly event related to the obstetric event, and also like premenstrual dysphoria, or old name is premenstrual um, depressions, PMD. So this is or PMS, premenstrual syndrome. It is related to the menstrual cycle, and also like perimenopausal affective disorder. So that means the episode of mood change related to the menopausal period change, and this is condition specific to women. But also, having said that, also another condition also more preponderance toward women, meaning more women have this condition. For example, depression, anxiety, post-traumatic stress disorder, and eating disorder. All this it's happen in men, but is outweighed toward women. For example, depression is 2-to-1 ratio, meaning 2 female, 1 male having these conditions. And of course, post-traumatic stress disorder even higher propensity toward women than men. And but we're looking at the other mental condition, for example, schizophrenia or bipolar disorder. So far, the science showed that this is equal between men and women. However, also we can look another level. For example, symptomatically, women have some difference in terms of presentation of symptom. So, and researchers also showed that both mental illness, these differences, you can see the difference from biological and also psychosocial factors. And women psychosocial factors has been very, very important what you call effect on why women develop mental health issue. And not only in mental health, in other fields such as criminology, education, and psychology has shown distinction between women and men as well. So this is need to be acknowledged as well. So why it is important to really look specifically in women? I try to elaborate here to give more understanding on what's the difference between men and women. For example, psychological coping issue. In women, mostly it is reckoned that women tends to use internalized emotion. So they tends to internalize the feeling or emotion that they experience, which result in withdrawal, loneliness, and also depression. That's why women tends to have this presentation. And in men, for example, men's more externalized. So externalized mean that's why they're manifested with aggression, for example, showing the frustration, and this is, I think, in addition to the physical presentation in men, this is another issue why aggression have that tendency. And other than that, men probably more impulsive in nature, coercive as well, and showing some non-compliance behavior as well, especially toward medical treatments and so on. I mean, perhaps psychologically, man, we say that the ego system probably stronger than women. That's why all this being manifested just now, externalizing their emotion. And for women, for example, we can say in women there are more, when women talk, they talk about we, you know, so rather than I myself, we love, you know, so not individual, but with people around them, people who close to them, so that when they refer, you can see men mostly they refer to I, you know, rather than, you know, as the referring to the partners or other women that important in this man life. So this is some difference between women and men. And women tends to say, you know, have a I mean psychological I mean response. For example, it is okay not to be okay compared to men, you know, to say not okay is again masculine, masculinity, you know, again the manhood, for example, perhaps. And women probably more tolerable to a mistake, but men probably sometimes, you know, they are very um, strong in their opinion, you know, not allowing this mistake to happen, you know, cannot compromise with the mistake that happen as well. And probably women also have lower expectations subsequently. And and also women tends to express what their needs to other people as well, unlike men. Also, there's a research so that this is related to the intervention as well, how we want to approach this issue. Women probably more neuroticism, you know, means like the response to it, stress is more uh, emotionally related, more physically physically seen by other people, you know, when they face a stressful situation. And where this showed that, you know, there uh, external situation or psychosocial or environmental stressor may contribute to the why in women they are internalizing the things, and, you know, unrealizingly, you know, sudden they become neurotism in the response to that emotion or situational change around them. And of course, another issue of barrier to accessing appropriate care, I think I cannot emphasize more when Professor Nazima talking about, for example, the basic contraceptive measure, you know, even very male dominant opinion in certain country like Pakistan. Just now, when we hear that clearly, this is very basic, I would say, health right for individual, in particular in this context for women. But we can see how men dominating that issue, and this become one of the barrier for accessing appropriate care for women. So why there's difference? So biologically, we can see potential risk factors for women. For example, influenced by sex hormone. You know, hormones in men and women's difference, and women's perhaps also sign they showed that they have blunted hypothalamic pituitary and adrenal axis (HPA axis), which is nowadays HPA axis has been one of the upfront theory when we talk about biological element when someone have mood change or depressions. And also then of course women here life experience probably different. We're talking about women double shift. I mean, very this for men should recognize this issue, because um uh some women, working women, they need to work during working hours, you know, they have commitment, but come back home, they have a social cultural role, they still need to do to play role as mother, as wife. And sometimes this is also related to the culture, the local culture of individual. For example, in the Western, perhaps more difference, where um, women not to be seen as a traditional role in the kitchen, at home, doing home house chores. But in Asian culture, in domestic culture here, I think this culture still dominant, you know. So meaning like there's some expectation for women to perform this role at home. when they return from work, for example. And to make matter worse, in some situations, very dominating man in the in if there's a man there, then is the expectation probably higher for women to perform their duties at home. So this is the make women become double shift. I mean, this is overload. This is I have to say, sometimes house chores is more burdensome compared to work, do things at work. At home, doing house role of mother, taking care of children's, taking care of the home, the domestic issue can be very taxing and emotionally exhaustive as well. So this is important to be noted for men also, in supporting women. And of course, another issue, again highlighted earlier by Prof. Nazima, we're talking about those who are in the very deprived area, for example, when the resources is limited, men will get things first compared to women. For example, food, health support, social support, women probably lag behind, also including financially. And of course, with Dr. Selva also mentioned, talking about economic situation and social, professional, and also political, male still dominating. So this issue all in blend will lead the mental health performance or situation of men. It's not standalone, it's a very complex combination of all these factors. So it can lead to women lower self-esteem, perhaps higher tendency to rumination of emotion, and higher rates of interpersonal stressors as well. This lead to the self-esteem getting worse among women and affecting their mood and affecting their sense of mastery, meaning what they are able to control their situation. They feel like they are unable to control the situation compared to men. So they propose that women might be more vulnerable to these disorders because of their greater monthly and lifespan fluctuation as well, for like hormonal change, which relate to, as I mentioned, pre-menstrual dysphoria just now. I mean, this related to the monthly change of hormone, which obviously cannot only modify neurotransmitter and neurosteroid in themselves, but also influence their cognition and their behavioral as well. So in 1995, by the United Nations Beijing Platform for Action, uh, it has made a clear statement that women have the right to the highest attainable standard of physical and mental health, and the enjoyment of this right is vital to their life and well-being. So this is already well highlighted by the United Nations, and mental well-being for women, it is very important, and we cannot, when we talk about women's life itself, and respecting women for their right to the health, it is also concordance to the concept of autonomy of the person. The women should have autonomy on themselves rather than somebody control them or somebody lead them. So in other words, for example, when in the context of making policy for women, they should lead the discussion. Women should lead the discussion rather than being taken over by people who not so understanding the issue from the women perspective. Other than that, education for women is very important, and safety, economic security, legal right, all this important, and education as well is important. And we talk about reproductive right, for example, this is very important, where women should be allowed to have their own control. We can see as in the earlier talk, we talk about in some country, I think women is look like become a secondary citizen of that country where they cannot make decisions, all decision led by a person or male, made by men, rather than in the collaborative or in the what they call in the discussion between men and women, to make that decision. I think this is very unfortunate. I believe that women living in that country, as mentioned by Prof. Nazima earlier, sharing experience in Pakistan, women probably hard to be happy, to be in that country looking at that situation. So another aspect of women mental health, it is integral part of the health overall, and also the to the nutrition and educational outcome of their children. So women is a key. So we're talking about children. I think more people agree that it's led by women as well. So if the women mental health is affected, is negatively affected, it will subsequently will affect their offspring, their children. And violence against women erodes gender equality and the empowerment of women, as well as putting women at increased risk of HIV infection. So this is another worrying pattern that need to be addressed. So what is social factor in women mental health? So first is we talk about exposed to physical and sexual violence. Women make up majority of actually in the house. When we say, they could be in the more specific, women is more generic, but it could be adolescent, it could be single women, it could be divorced women, we call it single parents, and also widows. And it's clearly showed that women, much more than men, experience gender-based violence, for example. And this experience is associated with an increased prevalence of post-traumatic stress disorder, as I mentioned earlier, higher in women, also anxiety and depressive disorder as well. It seems obvious that violence must be taken much more seriously in diagnosis and treatment of women with mental health. And for example, focus on domestic and sexual violence, but also to include human trafficking. All this need to be discussed in the same context of mental health. And forced and early marriage, also this another issue need to be discussed as well, concurrently in the social domain. And good mental health always linked to the social justice and good physical health. This is very important, looking at the bigger perspective. Social justice, meaning like the community have a system, have steps to take care of their what they call legal right, for example. For example, in violent case, they have interim protective order. For example, it is very important to feel women feel secure. But how to reach to this helps, to achieve this social justice? This is another issue need to be addressed, because many women, I guess, they're not really able to reach or access to this what they call principle of social justice. They probably say, oh well, this is the worst. This is again the education background. Perhaps we are women. We always, we follow man decision only, or this is my fate. That's why I've been harassed by my spouse. Something like that. So rather than go and reach out, and the worst is sometimes they feel like no one going to trust me. If I go to the authority, they don't trust me. They said this is domestic issue, ini masalah rumah tangga. It is no one outsider can interfere with the domestic issue. So this is sometimes make them feel social justice not being served, and this is affect the women mental health. And 70% poverty also worldwide is women, and women are paid 30 to 50% less than men on the same job. Unfortunately, this is a worldwide average. And most women work in the lower status, more women in the lower status kind of job scope, informal work, household work, and home-based work. And also important issue, as I mentioned, women mental health always closely related to the issue of children and adequate childcare, especially a working woman, this is can be an issue. And now those who living in the urban area, they need to catch up for their financial needs, which is getting tough and tougher, so to give adequate, safe, good, adequate childcare also an issue. And this is indirectly will affect the women mental health because of that. Issue of discrimination also being recognized, especially toward women. This include marginalization of women in the society, especially in what they call making policy or getting solution for the country or for the community. Women should be at the mainstream as well. I think this is important to be acknowledged. Although there's legislation against discrimination in women, but not giving equal access for women to food, education, work, and healthcare and safety always been there, been present. I mean, it's good. We show some improvement in this. I think as time goes by, I mean, this is become better and better being addressed by people, but still it need to be work faster to achieve better what they call social support for women. And most country, 60 to 70% who seek mental health women. This is, as I mentioned just now, women willing to reach for help and the needs. And I think the rumination is bad, not so good when somebody could ruminating their problem over and over again. I think this is a tendency for women. However, this make them go and seek help. Compared to men, they are not ruminating their problem very much. They more keep their stress to themselves. They are not willing to say, not really, not acknowledging they are not right emotionally. Kind of people, say tak apa, tak ada apa-apa, denial, all this more prominent among men. So this is have also grave consequences. But when talking about in this context, at the end, women seek help from mental health care compared to men. So when talking about discrimination, we can see in the domains of employment, education, food distribution, healthcare as well, and resources for economic development, being the CEO of the company. Sometimes they also have what they call discriminatory in nature, like preference for certain gender compared to looking at their merit and competency, ability, and so on. When talking about education, it is a very important factor, is a key in achieving good mental health as well. So especially about health. So to reduce maternal mortality, for example, among women, how fast they should seek help, and if they have what they call barrier to seek help in health, what they can do, or legal help, what they can do. This is important to be empowered toward women as well as, and also like reproductive health, also very important because it's closely related to other emotional outcome in women subsequently. Also better nutrition, education on better nutrition, higher economic well-being, education for whole family. This awareness is very important for women to have, to be equipped with at this current age as well. And encourage participation in development and social status among women. This will protect against domestic violence when they have education where they can seek help what the NGO can help. For example, this is important information to pass to them. However, the data showed that twice as many as women as men who are illiterate worldwide, meaning women 2 times more in prevalence, to have illiterate worldwide. Of course, this is very deterrent to achieving the objective of education, because key to achieve good education is literacy. So when women have lower literacy, uh, education or knowledge hard to be passed effectively to them, and this will result, I mean, their situation, their social situation won't change, because they don't been equipped with the knowledge what right for them, what they need to do, what opportunity for them to change themselves. So next one, we're talking about infectious diseases. So risk of being infected, this is being touched a bit earlier by Dr. Nurul. Risk of being infected with HIV during unprotected sex, it is higher in women 2 to 4 times, and 42% of deaths related to AIDS in 1999, long time ago. Probably now it's probably less, higher among women. And women might have hard or impossible to insist on safe or uncohesive sex. This is another issue, very difficult to be addressed. Is very much social context, how it can lead to. It is also diseases such as tuberculosis and malaria, for example, claim more life in women. And so why women actually have higher risk? So women, they have a greater exposure and worse nutrition and less access to the adequate treatment in women. This is among the important topic in mental health about violence, or sometimes we call it interpersonal violence. Um, So it is a global issue, global problems when we talk about violence against women. So while both sexes benefit from this factor, and the overall rates of mental illness are similar, men and women, except some illnesses more preponderance in women. Women's unique role in reproduction, the family and society, and their often low social economic status compared to men in general. So this is might predispose them to action of violence. So domestic violence and abuse is recognized as an expression of power inequalities between men and women, unfortunately. Many more of this inequality exist and can most likely also influence women's mental health, such as gender role traditionality and gender harassment, or some discrimination in the workplace or during professional career, and would certainly justify their own review. I mean, in terms of why women have likelihood to be the victim of violence. Gender-based violence, it is a result or likely to result in physical and sexual, and of course, at the end, result in the mental health or mental harm and suffering to the women. And beside this physical and sexual deprivation of liberty, for example, there being a coercion, for example, also, or threat, also encompassed toward this, toward the violence against women. And also when we talk about this war and civil unrest, I mean, this is the worst part. I mean, when there's a war, there always been women become the unfortunate risky victim, and women and children, for example, we can see those people who physically lowered compared to men, for example, they are more likely to be the victim. And trafficking women, for example, forced prostitution and sexual tourism, also a threat as well to women mental health. So which group of women have a higher risk? We can see poor and older women, probably higher risk. Mentally ill women also at the higher risk. We can see mentally ill women. My close experience patient, like patient with bipolar disorder, for example, in women, they have increased sexual drive where they go and seek unprotected sex, with other people, very seductive to other people, it's easily become uh, what they call abuse by men in this context. So it is very important to be aware about this risk as well. And that's why it's women with disability also at higher risk. Women in institution, I will talk longer afterward about in the prison where I have some experience before, and ethnic minorities as well, also at a higher risk. Sex workers, traffic women, human trafficking, always an issue is beyond the mental health. Of course, it relates to mental health consequences. My issue to tackle it is more than that. It's a social issue, it's a legal issue. Women during armed conflict, as I mentioned earlier. Uh, the consequences of violence between interpersonal violence in women. So it causes distress, psychological distress, and also reduce quality of life, and also physical and mental health consequences, even death. While men are more likely to be injured by stranger during the commission of a crime or in a war, but for women are more likely to be injured by their male partners or other family members, and often someone they live with or they know. So this is a profiling between interpersonal violence when talking about men and women. We can see the difference in the pattern. Women more likely to be murdered by their intimate partners than by strangers. And therefore, it is important to consider slightly different in approaching male and female violence. And so interpersonal violence encompass toward battery, sexual assault, psychological abuse, and harassment. And cultural norm, social expectation, and gender roles and relations may promote such violence against women. We can see some group of peoples or in the community uh, even show hostility toward women, and this being perceived as normal. I think the worst is if this manifestation come from people at the higher rank in the society, the community representative, something like that, and in the public, what do you call, in the public display. I use the word display because other people can see, can watch this happening, and they are ridiculing women, and so gender remark very negatively to a woman. I think this is very unhealthy, very I use the word sickening as well, in what we try to promote here, right, for health for women, but this is detrimental. This kind of behavior can be detrimental toward women. These social forces may determine the consequences to women and response of the society at the end. And media and advertising too often portray violence against women as acceptable. This is also very unfortunate when we see this is in our media, where the social media or electronic media or mass media, where elements of manipulating women or even uh, endorsing, kind of accepting violence against women as a normal things, is been displayed. So this is also not healthy overall in terms of ensuring right for health for women. and it can affect mental health overall. And mental health consequences of interpersonal violence in women. Women who is victim of interpersonal violence may develop, I already mentioned, psychological distress and low self-esteem, depression and anxiety, post-traumatic stress disorder, borderline personality disorder. This is another big issue as well, where the personality of a person is not so stable. They are very fragile emotionally. They are vulnerable to be abused. They are showed inclination toward suicidal behavior as well. This is encompass borderline personality. They feel rejected and hard to take other people's emotions as well. Though this is in brief, borderline personality disorder constitute. Other than that, of course, it lead to the substance abuse issue among women and sexual dysfunction and also acute and chronic physical disorder. And interpersonal violence, violence and abuse in early life are strong predictor of later mental illness, especially depression. So meaning that what they underwent during childhood can affect in the adulthood subsequently. Their interpersonal violent experience during early days. Being assaulted or witnessing an assault increases the risk of mental disorder and also risk of subsequent risk of abusive relationship if they already seen this or even being victim. They could be perpetrator or they could be the subsequent victim where they feel helpless and hopeless in their situation, lead to the depression and feel suicidal as well. And also it can also form unstable personality, as I mentioned earlier, can lead to the borderline personality. Violence against women also has negative secondary effect for families, community, and society as well. That's why in terms of this, I think it's important to have legal protection for women, those who become a victim of the situation, and support group, for example, in psychiatry we work, we always refer case, for example, to WAO as an NGO for those women experience or as a victim of the domestic violence, because it need further legal steps, for example, to get IPO, interim protective order, protection order, and so on. In the special population, very brief here, but I will describe more about the mental health, mental illness women in prison because subsequently. So girls, children, adolescent girls, working women, all this is can be considered special population, as I mentioned earlier. Women in civil unrest or war, even more prone. Refugees, also more vulnerable. We hardly not being being highlight issue in the national issue, but this is important. Refugees and immigrant women, they are also at risk. So this another part of my talk where I'm focusing in the special population, which is in the prison population. In 2005, women prisoners population increased as much as 35% compared with male prisoners only 7%. This is some data from the Prison Department Malaysia. And research showed that 90% of prisoners has psychiatric disorders and 95% have personality disorder as well. So mental health issue in the prison should be paid attention because they stay in the prison not for long. Most of these they will come out at some stage sooner than later. So they need to be address their emotional need and mental health in particular, because when they go out, then if their mental health not been primed while they're in the prison, not been addressed while in the prison, they tends to involved in the same crime again. They will go back to the same cycle, and higher rate of psychiatric disorder in women prisoners as well, as documented by this researcher. And between 64 to 84% have been diagnosed with psychiatric disorders, okay, among these women prisoners. And most common were PTSD, post-traumatic stress disorder, antisocial, borderline personality disorder, and substance-related. This is, I think, overall for men and women. So this is because antisocial personality disorder is more for men, as well as substance-related disorder. And 20% of women prisoners in UK were diagnosed with borderline. As I mentioned earlier, borderline personality is important, where they actually, this group of borderline personality, they have a tendency to harm themselves. And psychiatric disorder are more likely to present with comorbid substance, okay, in women. So in women, they always have both. Other psychiatric disorder with substance versus in men is mainly is substance-related disorder. Okay, and affective and borderline personality is more prevalent in women prisoners compared to men. And of course, higher prevalence of past history of child abuse in women who committed crime, as I mentioned earlier. Some research suggesting that the presence of psychiatric disorder have increased the tendency of criminal behavior more in women than in men, meaning like if they have mental disorder or among prisoners, women prisoners, they're more likely to be found to have mental disorder compared to men. So women prisoners have a tendency to have mental disorder and like 5 times more likely to commit offense. Those who have major mental disorder among women, they are 5 times more likely to commit offense compared to men. The lower rate, higher rate of psychiatric disorder in women with repeated homicide or attempted homicide offenses. That is mental illness per se. Of course, another important factor is psychosocial factors. Psychosocial factors have also been linked to criminal behavior. Women prisoners are aged in their 20s and 30s are likely to complete school secondary, largely unemployed. So you can see all these parameters uh, in social domains, very negative. For example, economically poor, history of sexual physical abuse, and so on. So in women prisoners who presented with psychiatric history, they are also likely to present with history of incest and poor maternal relationship. This is issue of what they call bonding or attachment, an issue. And the worst is incest also have happened more among the women prisoners. Around a quarter of women prisoners have psychiatric disorder in one or both of their parents. In Malaysia, there are 16 and 18% of women prisoners have sexually, physically abused, as they reported during a survey. Women who are involved in criminal activities have received double blow because first they commit crime, then subsequently, and they are women. Because women involved in crime, I think is like double stigma from the community. Whether in the West or in the East, we had to accept women who actually who manifested with criminal behavior. On the top of they are having mental illness as well. And why they have mental illness? Because of the psychosocial issue that they experience that lead them to act in such behavior. And the importance of relationship, social support and network for women and impact on mental health is very important. So their support system who they have received close to them, it is very important to give emotional support to prevent them from repeat or to avoid them from doing the criminal behavior. Women often display great resilience at the end, compared to men. I think women is more great resilient as shown in some research. Enhancement of women autonomy should play a key role in mental health policy and service. So there's some recommendation from World Psychiatric Association in terms of addressing issue of women right to health, in particular mental health. First is support psychological health promotion program that encompass the life context of girls and women to include equal access to basic human rights, education and employment, and eliminations of violence and discrimination, and the reduction of poverty. Also to support women's marital, sexual, and reproductive choices and ensure access to safe motherhood. to support public education and awareness campaign that increase recognition and reduce the stigma of mental illness in girls and women, and also to support to support safe, respectful, appropriate, and gender-sensitive comprehensive mental health and physical health services for girls and women across the life cycle, irrespective of their economic and social status, race, nationality, and ethno-cultural background. Support timely access to adequately skilled mental health professionals who provide quality of care consistent with the best current knowledge and availability of appropriate therapy, technology, or drugs, and who take women's special needs into consideration. So this what been recommended by WPA, World Psychiatric Association. And the last two here is support the provision of accurate information and respect choice in treatment decisions making by girls and women whenever possible. And the last but not least, to ensure the mental health care for girls and women that is free from breaches of fiduciary responsibility, meaning the support system, whether it's a mental health personnel or family members or friends, the fiduciary, the trust, the by the patient or by the person to another individual should remains, rather than there's a breach or there's a break of confidentiality and so on. So this is my last slide. Mental health must be recognized as important issues in women, and many factors determines mental health in women. Denial, ignorance, and isolation of women mental health must end. The social, economic, and cultural aspect of women mental health must be addressed as much as biological aspect, because I think it's easier and probably more common we address the biological aspect. As I mentioned earlier, in mental health, more women seek help compared to men. So I think the biological part probably better addressed. But how about the psychosocial, social, economic, and cultural aspect? We've always been lagged behind. There hardly have any paradigm in the society looking at the women issue. This could be achieved via education, empowering the women themselves, and multidisciplinary approaches, prevention and management is very important, not single entity and so on. And there's a need, the change in social cultural misconception on women, including not accepting normalizing violence against women, not acceptable and shouldn't be made as perceived as a cultural norm. Okay, I think I conclude my talk today and about women and mental health. So I pass back to Dr. Raj, who chaired this session. Thank you.
Thank you very